Hi everyone, my name is Maria Southmayd, and today I'm sharing my final project, which is a critique on Metzger and colleagues' evaluation of a peer-to-peer health education initiative in Los Angeles public high schools. This evaluation really stood out to me because of its focus on adolescent empowerment and health promotion. I chose this evaluation because peer-to-peer education has become an increasingly important strategy in public health, especially around sensitive topics like mental health, sexual health, and substance use prevention. Adolescents often learn best from peers they can relate to, and the program's equity-driven design aligns strongly with my own interests. The program was implemented across 8 LAUSD high schools, serving diverse, predominantly low-income student populations. Students led tabling events and classroom presentations that aim to improve knowledge, reduce stigma, and connect students to tools and resources. The context felt especially relevant given California's post-COVID focus on youth well-being. The evaluation aimed to understand the short-term impact of these peer-led events, compare them by topic and grade level, and examine whether voluntary peer-led activities were more engaging than a mandatory adult-led presentation. These questions were clearly aligned with the needs of stakeholders like the LA Trust and school wellness staff. The evaluation was grounded in the Health Promoting Schools framework, which emphasizes empowerment, social learning, and integrating health promotion into school environments. The literature reinforces why peer models resonate with adolescent learners and why they may outperform traditional adult-led instruction. Methodologically, the study used non-experimental cross-sectional design with QR-coded Likert surveys completed by 343 students. The analysis used appropriate non-parametric tests given the ordinal data. The design was practical and aligned with early-stage evaluation, though limited for assessing long-term outcomes. Findings were consistently positive. Students reported learning something new and useful, gaining tools and resources, and feeling more connected. They were also more likely to attend future events and recommend them. Notably, peer-led voluntary events outperformed the mandatory adult presentations, highlighting the value of relatable messengers. Strengths of the evaluation included its strong theoretical grounding, culturally responsive design, logical model alignment, appropriate statistical analysis, and high student engagement. These components made the evaluation both relevant and meaningful. However, the study also had its limitations. It relied solely on self-reported surveys, lacked demographic data for equity analysis, and used no qualitative methods and used instruments that were not validated. The cross-sectional design also prevented assessment of long-term behavior change. The implications are significant. Peer-led models should be expanded and supported through wellness centers and youth leadership initiatives. Policy-wise, the findings fit California's broader priorities. For research, mixed methods and longitudinal tracking would provide a more complete picture for the program. On a personal note, this project helped me understand evaluation as a structured, interconnected process. Logic models, indicators, sampling, validity, all of the concepts from this course shaped how I approach the critique. I also gained confidence in applying theory to real-world evaluation studies. Thank you so much for listening. I'm happy to answer any questions. Please scan the QR code to access full paper.